McInerney from Croaky here, and I'm speaking at the Oceania Tobacco Control Conference with Dr Patricia Nez Henderson, who is an American Indian woman and public health researcher from the United States. Could you introduce yourself as you so beautifully did in your presentation?
Ja, Patricia Nez Henderson, antin shlon, twotsani bashichin, chanjikine dashanalada, asche dashache, kota esanda amado zeil in Inchlan.
And can you translate that in English for us?
Absolutely. I'm Patricia Nez Henderson. In the Navajo language, we have 4 primary clans. So I've introduced my 4 clans, and just thanking you for this wonderful interview.
Thank you very much. You gave a really interesting presentation, and particularly around issues of cultural practice and sovereignty, which I'll ask you about in a minute, but could you just scope out at the moment how much of an issue smoking and tobacco is for American Indian communities?
Sure. Among American Indians and Alaska Natives, we have one of the highest rates of smoking compared to the general population, where in certain communities it hovers around 50 to 60%, both among men and women, and there's high rates of initiation among Native youth as well. So, but they're regional. So, for example, in the Southwest, the rates of smoking are actually a lot lower than the general population. But unfortunately, we're seeing an increase among those tribes as well. So, I think just social norms are changing within those regions.
So there's some big historical reason for this, and the very interesting thing was around cultural practice and allowing commercial tobacco separate from tobacco used in customary celebrations to get a stronghold in Native American communities. You said particularly that the government had a direct role in it. What happened?
Oh, absolutely. Back in the 1800s, when the federal government, the United States federal government, was trying to get rid of American Indian tribes, one of the laws that they've used to really probably control us was to get rid of ceremonial practices, prohibit the use of ceremonial practices within Native communities, including the use of sacred tobacco. And because sacred tobacco was no longer allowed, a lot of the tribes began to incorporate commercial tobacco products within their ceremonies. And today we see it very, it's very prevalent in many communities where within ceremonies, within cultural gatherings, powwows, for example, cigarettes are given away, children have access to it. So it's become a part of the norm, unfortunately, throughout the years.
To the point you said where the birth of a child, there may be cigarettes given as gifts. Can you sort of explain some more of those?
Oh, absolutely. In many tribal settings, actually, cigarettes are freely given out. For example, at the decease of a person at a funeral or at a wake, cigarettes are given away as gifts. Or at a powwow, you have drum groups, for example, that are singing, and a way to acknowledge the drum groups is you give them cigarettes. So it's highly prevalent in our communities, unfortunately.
And can you describe the difference between the ceremonial tobacco, it's as an actual plant, but also its sacred role in culture?
Oh, among the Navajo people, and so I'm speaking only on the Navajo side, there's other tribal communities that actually use plants for ceremonial purposes. But among the Navajo Nation, we have several plants actually that are used for ceremonial purposes, and we call it zifnut or mountain smoke. And they're cultivated in mountains within the Navajo Nation and are used for ceremonial practices.
And yes, but since then, because of that century of being a ban, they phased out. Now, you said there are real issues of sovereignty on a number of layers for communities, and that the tobacco industry has found its way very much around those. Can you describe what those barriers are?
I think, just for correction, people continue to use the sacred tobacco, so it's not, unfortunately, actually, it has not gone away completely. So there's been a revitalization to bring that back and to have more Native people, particularly Navajos, begin to use sacred tobacco within their ceremonies again and getting rid of commercial tobacco products. In terms of sovereignty, American Indian tribes, including Alaska Natives, are sovereign lands. They're sovereign tribes and they have sovereign lands, meaning laws that have been passed by states, for example, in terms of commercial tobacco policies, don't necessarily go into the communities on which the tribes live on. And so in many cases, these tribes don't have strong policies in place. And that, such is the case for Navajo Nation.
And you said that's been an issue. There's been an unwillingness, a lot around revenue. There's a lost revenue, and because of the involvement of casinos on tribal lands and things like that too. Can you explain that?
Well, because of laws that were passed by the federal government, basically to get rid of tribal communities, right? Unfortunately, because of that, poverty became a huge issue among many tribes, and as a way to bring back economic development into these communities, casinos were being developed in a lot of these communities. So, and a lot of tribes have done very, very well with with casinos. However, I have to say, however, many of these tribes, majority of these tribes actually have casinos that allow smoking within their facilities, so workers and patrons are exposed to secondhand smoke. And so we have a lot of work to do in that capacity, is to educate tribal leaders that initially the revenues will drop when they go smoke-free, but they will come back up. Data shows that, research shows that. So it's been our role as both researchers and advocates to really educate elected leaders primarily and community members about this important work, and that it needs to, that we need to do whatever we can to protect individuals that are exposed.
So with all those barriers, what have you been doing and what's working for you? Because you are seeing good gains, aren't you?
Oh, absolutely. Throughout Indian country, there's been a lot of advocates out there that are doing some tremendous work in communities. And for example, on Navajo Nation, we've made tremendous strides in educating traditional healers, all the way from traditional healers to elected leaders to community members, about the dangers of secondhand smoke, and as well as really beginning to better understand how we as Indigenous people can go back to what is natural, meaning the sacred role of tobacco, and using that instead of commercial tobacco products. And it takes a lot of education, as you can see.
And what are a couple of projects that you could highlight?
Oh, we've been doing several work. Actually, we've been doing a lot of work. In terms of research, we've just completed a study where we're working with Indigenous communities and smoke-free homes, and using science basically to educate members of the household in making their homes smoke-free. What we've done is we've actually taken urine of children who are exposed to secondhand smoke within their homes and measuring it for cancer-causing agents like NNK and NNAL, and using that to educate family members about the exposure that is happening. And then that's just one research project that we've completed. And the other work that we're doing is just really working with coalition members back down on Navajo Nation, and giving them the tools so that they can make I guess, advocate for stronger policies on Navajo Nation.
And what are your priorities at the moment? What would you like to see done?
Oh, there's a lot of work that needs to be done. Yeah. But in terms of policy, we know that exposure to secondhand smoke causes many different diseases, and it just it just takes one policy and an enforcement of that policy to create that change. And so I think there's 566 federally recognized tribes throughout America, and there's state recognized tribes as well. And it's just creating a policy where everybody can be in a room or in a place where there's no smoking.
I wish you all the very best for that. It was a fantastic presentation. Thank you very much.
Thank you.